So what the doctor does is they log into Q Rounds. It's in the app store or on their hospital device. It pulls their patient list from the electronic health record of the patients they already have to see. It suggests a rounding order for them, including things like who's going to be discharged today, who's the sickest patient, what nurse assignments, who needs an interpreter. They're able to drag and drop into the order they want to see patients and hit share. That process takes about 41 seconds. I do it in the line at Starbucks on the way into the hospital. So I share my list. Once that gets sent out, three things happen. Every nurse gets pinged on their hospital device. These are devices they already have. We didn't want nurses to have to learn something, download an app, log in, remember a password. It's going to what they already receive. Dr. Pitt shared his rounding queue. You have three patients on the queue. Your first is at 10:15 in room 74. So they get a notification. Second, it goes to the electronic health record, so everybody can see that rounding queue in real time. That's where things like social workers, care coordinators, discharge pharmacists are relying on that to be able to join the team at the right time. But the game changer is the family. If you've ever been at a hotel and gotten a text that your room was ready, or from your flight that your flight was delayed, families receive a text message in the morning that the rounding queue has been shared. They click in, they see a dashboard that shows them when they're expected to be seen, their queue position, and the ability to RSVP. Call me, not today. We're actually just doing a partner where they can join virtually and they'll pop up on the television screen if that hospital's enabled for that when we walk in the room. So families RSVP, they can invite additional families. We integrate with your interpreter system. So now when I'm ready to round, anytime I hit next, everything updates downstream. The nurse is notified to meet me at the room. The family gets a text, we're on their way. And if they've RSVP'd to join remotely, when I look at my app, that start call button is lit up and blinking. And with one click, I press that button, my phone rings, dad's phone rings, and if necessary, an interpreter's on the line. So that's how we've had almost 35,000 families join remotely via that approach.
Okay, thanks. I love that description. That's really vivid. Thank you. So I think I see how this is working from the user's perspective. Now, give me an example of what happens when something happens to the doctor's rounds, like one of those fires happens, somebody's sick, something has to change. How does that filter through this user experience?
Yeah, so anybody with access to the queue can pause it. So if something comes up, I get pulled in a direction, pause, every family gets downstream, gets a message that rounds have been paused and you'll be kept in the loop when they resume. The nurses are able to see that in the sight line. So again, right now, all of a sudden, they're just not there and people don't know where they are. This is actually keeping everybody in the loop in that process. And because it's a hospital where families understand that patients are sick and things come up, there's a lot of grace in that. We have just seen in our most recent go live that we're within 19 minutes of that estimated rounding time is the average. So we're still landing in that window, but that transparency of real time pausing notifications changes is a key.
Yeah, this is right in my wheelhouse, Mike. Someone who is both a psychology and a human factors a doctorate. I think people underestimate, to your point, the value of any level of transparency versus knowing nothing, right?
Absolutely. We've seen this in those other industries. The cable guy window of it used to be 8 to 4, and now we at least get the dispatch text that they're on their way, and you can start to plan accordingly. I had a situation this week where somebody from the irrigation blowout I didn't get those notifications. I didn't know they were coming. I was in a meeting. They walked in the house and my dog chased them down and lost their mind because they let themselves in the house to do it. So, just that ability to be getting the real-time update on anything has become kind of table stakes in every arena but healthcare.